Welcome to the International Conference on Agrarian Change. The session you're about to attend is titled Session 4B, and it will run from 2:15 to 4 p.m. On behalf of the organizing committee of the International Conference on Agrarian Change, I'm pleased to invite Ritu Dewan to chair this session.
Here, and of course, as usual, 20 minutes each, for which I'm going to be little strict. So after 15 minutes, I'm going to just say, so we can have some time, at least 20 minutes for discussion. I will not give any gyan after every paper. We'll move on from one paper into the other, and please make your notes in terms of questions and queries and clarifications, so which we can take up in the last about 20 minutes. We'll go according to the order in which it is already given. So and in fact, it's very interesting because I've been through, of course, all of us have been through all the sessions, and this is one session I think is thematically really integrated. So in a way, it's going to be a really very interesting kind of a flow with different perspectives or supporting kind of perspectives. So first, Himanshu, work and well-being in rural India. Mariam Dhawale is going to talk on microfinance, women and poverty. Ruchira Bhattacharya, poverty elevation trajectories, okay, Southeast Asia and Pacific. And Jiju Alex on strategies of poverty reduction in Kerala. So we'll start right away. Himanshu? Yeah. 20.
Yes. I'll help you. 15. Okay, so thank you, Ritu, and I'll try and stick to the time limit. So I'll rush a little bit. But really, what I wanted to talk about are the two issues. One is what has happened to well-being in the last 10, 15 years, roughly, for which there is a debate which is ongoing, particularly on what has happened to poverty, inequality, and various things. And to a certain extent, the answer to this may lie actually in, if you're looking at what has happened to the world of work, the employment structure in a sense, all of which are interesting. They're better than, at least in terms of data and their ability to tell a story, better than the poverty debate as such. But I still feel that there are issues on the employment front which we need to grapple with, which we are not able to understand, which we need more deep, in-depth analysis to be able to make sense of what is going on. And some of this was actually raised in the sessions yesterday, and to a certain extent in the sessions today also. So I'll quickly run through. So the basic story basically comes from this assertion that has come out by the government of India, endorsed by the government of India using the World Bank numbers, that more or less India has eliminated all forms of poverty. Extreme poverty is something which is talked about. Very simply, and this is using the World Bank numbers, which the PIB very proudly proclaimed as the certificate that was given by an international agency for having eliminated extreme poverty. So the last number that they came out with, that came out in June, that suggested that India has only 5% people who are in extreme poverty. That is with the updated poverty estimates. 2 months before, they came out with another number, which basically said that it's only 2.5% people who are poor in this country. Anybody who has moved around in the countryside, moved to the rural areas, will certainly have some problems in digesting these numbers. But if you want to really know what is the comparable numbers, those numbers still suggest close to around 10 to 12% people who are poor in this country, although those are also all likely to be not a proper estimate, but better than the World Bank, but on a lower side than what will be there. So that is something which is the problem that we are still trying to grapple with as to what has happened. And this is a period which is a very crucial period. Last 15 years is a period which is a crucial period, which we need to figure out. It's a period where we had the demonetization, the GST rollout, the pandemic, the Great Indian Slowdown that was talked about by Arvind Subramaniam and others. So what is basically happening is what I'm trying to figure out. And one way to do it is to basically look at the data which is the employment data, which is less contentious than the, say, the poverty data. And it is not something which is a new thing that I'm trying to do. This is something which has been a standard practice that people have been doing it. Particularly wages and earnings have been used as a standalone proxies for poverty measures. People have calculated only on based on wages and earnings. And fairly rightly so. In fact, if you look at the history of the way poverty lines were set up, the Pitambar Pant Committee in the 1960s and all, they all looked at minimum wages or the wages of agricultural laborers as the way of setting the poverty line. So that was something which is the initial framework, that is how it started with. But now, this is something which is now showing a completely different picture than what we'd get from the other data sources. So I'll quickly run through the data and then I'll come to the questions that I wanted to pose. So there are three things which are happening. One is that overall, after 2018-19, there's a massive rise in employment. Overall employment numbers have gone up quite substantially. Niti Aayog members have come out and basically lauded it as a success of the government strategy as to how we are creating more than 20 million employment per year or something like that. But if you look at break it down as to where the employment is being created and what is happening to earnings and wages and what people are, the quality of employment, you find very disturbing trends. The three trends that I want to highlight. One is that we have seen for the first time, we are seeing since 1973 that the data is available, that the share of population working in agriculture has gone up. Absolute number of workers in agriculture was going up, even up to 2004-05. After that, it declined. Roughly 35 million people went out of workforce between 2004-05 to 2011-12 from agriculture sector. That is what should happen. If an economy is growing, that is what would you expect. A structural transformation that we were all waiting for and finally happened after 2004-05. But after 2017-18, what we are seeing, the first time, and I'm again emphasizing that, first time the share of population which is working, the workers in agriculture, is increasing. That hasn't happened even earlier. Since 1970s, we haven't seen that happening. So that's something which is the second, I think, is something which is, again, a remarkable increase in the number of women workers. And that has increased, again, phenomenally. Quite a substantial increase in the number of women workers. And the third one is obviously accompanied by a reversal of the trend. Again, all of these are not fitting in the trend from 72 to 2017-18, and suddenly these trends are completely going in the other direction, which is the increase in self-employment quite substantially, and a decline in the quality of employment that is coming from various data sources. So then I'm going to simply present few information as to what is happening to earnings and incomes and employment, and then finally try and bring together for that one. So this is something which is on what happened to the data that is coming out from, and it's a method which is approved by the Niti Aayog, by Ramesh Chand, who uses these numbers and has put out these numbers in a paper by Niti Aayog as a, when Prime Minister announced that the farmer's income will be doubled, then people asked, but where is the data on farmer's income? And then he calculated, these are the farmer's income. So I am just calculating his numbers and taking it forward, which basically suggests that forget 5 years, even after 7 years, they haven't doubled. They are actually, between 2017-18 to 2022-23 is the 5 year, exactly 5 years that the government claimed that it will double. It actually went down by 3% per annum. Overall, if you look at it from 2011-12 to 22-23, it's growing by only 1.2%. Between 2004-05 to 11-12, it was growing at 7.5%. These are all official numbers. Wages data is the one which is where complexity comes in. And therefore, you'll have to look at multiple data sources. So I'm introducing one more to the puzzle, which is, and this is the data that is coming from the agricultural wages in India. And that information basically suggests that up to 2011-12, wages were increasing around the same rate that you saw from the other one. But then after that, it stagnated and more or less has been stagnant since 2014-15. So after 2014-15 is when it basically stagnates in real term up to 22-23. This is something which is well known. People have presented it. Everybody is there. But the AWI data now confirms that this is not an aberration, but it is actually something which is there. This is where the problem comes in, and people have asked, because the NSS, on the other hand, will show that the wages of casual workers has increased by roughly around 3.5%, and that is where the problem basically comes in. But that comes only if you're looking at the casual worker wages. If you look at, for example, what is happening to regular worker wages, then that is an absolute decline. So one way to look at it is, what I try to do is to look at all workers who are working in an employer-employee relationship. So all workers, if you do that, then the numbers look far more, a little bit comparable in that sense. Then the overall growth rate comes down to around 1.1%, not very different from the WRRI or the AWI numbers. So one problem that is here is that, is there something that is happening between the casual and regular ones? Remember, the definition of regular in NSS is actually only in terms of security of tenure. Whether you get paid on a monthly basis, on a regular basis, or you are basically being paid on a daily basis or on a, other than that, there is not much of a difference. This is the only difference which distinguishes between a regular and the casual worker. So is there something, and that information has to come from, so is there some kind of a shift happening between regular and casual workers, not in terms of definition, but some work that was being done by casual workers is now being counted in regular, or something else is happening, we don't know in that sense. If you add the self-employed one, which is increased quite substantially, and the same period 17 to 22, 23, it actually declines by roughly 1.5, 1.6% per annum in real terms. And so if you calculate all the workers, then the WRII numbers of what is happening to earnings of workers and their earnings from the NSS, they're actually matching. They're exactly the same. So there is something which is happening in the labor market, and this classification, regular, casual, and self-employed, is something that needs to be probed as to what is happening there. This is on the unorganized sector market, and which again shows kind of a decline, which is not very there. So quickly running through, part of the puzzle is basically where we need to probe deeply into try and understand that how meaningful is this distinction, the regular, casual, and self-employed, in terms of its ability to tell a story about what is happening to earnings of workers. I mean, and if you combine together, then the stories are more or less lining up, but then individually they are very different. The second, I think it was pointed out, that one is a wage rate, the other is an earning, and therefore there are problems in comparing those ones. So those are the third reason, the third way of looking at it is the whole increase in pluri-activity, which is that there are no, if you go to do a village survey also, I mean, pure agricultural laborers are now going to be very few, I mean, very rare in that sense, or pure cultivators, people who have only employed in agriculture as a cultivator and not having any other. Many, many households, most households, in fact, more than 3/4 of the households would have one leg in the non-agricultural sector, or even in the, if you're, say, for example, casual worker, then there is somebody is a regular worker, somebody is self-employed. So there is a multiplicity of employment categories which are there, and therefore deciding the employment categories also becomes a complicated issue. So what we are doing, the second part is the employment part of it. Again, you see the massive jump that happens as far as employment numbers are concerned. But share of agriculture in total employment is what increased up to 22, 23. The female employment part is largely explaining what is going on. So if you break it down, then the female employment part is certainly is a distress-driven one, and that's something which is more or less many people have said. I'm not going to spend much time on that. But even the agricultural pushback, I mean, people going back to agriculture is certainly a sign of, distress in the rural economy, not a sign of progression, not that agriculture is thriving, that because of that there are more people are simply lining up, queuing up to join the agricultural workforce. It is certainly a distress. And look, this is something again from the administrative data, and I thought I'll bring it because there's more faith in the government data than independent data. But this is government data. The government of India itself is saying that 30% of total rural households, on an average, have been working on NREGA wages, which are 2/3 of the market wages. Now, these 30% people are either fools, because there is no extreme poverty in this country, but they still want to work in the back-breaking summer heat at wages which are 2/3 of the market wages. And this is a consistent pattern for the last 5 years. Remember, this data doesn't include 2 states, West Bengal, where NREGA has been closed for the last 2 years. If you add that, this number might go a little bit, inch up a little further. Same about PDS. I mean, like the offtake has been very consistent. And how much do you get? You are getting roughly 200 rupees per month per family. Roughly like that much amount is what you are getting, and 40, 45 rupees. And you queue up. In many places, people are actually going to a PDS shop which is 5 kilometers away from the village. And if really, so that's the small amount for which they are actually going. And this is again official number in the eShram portal. 94% of registered workers reported monthly income of less than 10,000 rupees. Monthly income of less than 10,000 rupees. And then again, 4% between 10,000 to 15,000. So that's the number that we have. So what I do is basically, how do we estimate poverty using these two numbers? Use the employment numbers to do that. It's a very simple old technique that I'm trying to do, is to use what is called a survey to survey imputation, which is use the employment numbers to predict consumption expenditure in the terminal year where there is no information on, or the data on the consumption expenditure is doubtful. So that's what I'm trying to do. It's a very, very old method, and people have been using it. World Bank has used it. Various other people have been using it. So we have one data, which is what we call as the training data, where we get the regression estimates, and we use the regression estimates and use it in the next round of the data. So this is the basic one. I'm not getting into this, but I'll show you the structure which is there. So what we are trying to do is to do the exercise, regression exercise in 2011-12, using, now what we're doing is, the additional thing that we're doing, that we are going from the consumption expenditure survey to the employment unemployment survey. And once we are confident that the employment survey is very representative and can be used, then we use the employment unemployment surveys to predict outcomes in the PLFS surveys, which are available from 2017-18 to 2022-23, and these are not corrupted. So there is no contamination in these ones, there is no comparability issues, so we are confident that we can actually do that. So we basically are using 17-18 onwards, the PLFS, to see what is happening to poverty after 2017-18. So very simple strategy, not much complicated one, a simple basic regression, but there are some complications that we be careful in terms of what is to be done, what is not to be done. So let me show you the results, and that should actually be helping you to. Before that, some caveats, which is that we are making a very, very strong assumption, which is not actually a very bad assumption in that sense. We are making an assumption that the employment market, employment-related information, which is in earnings, quality of employment, your demographic variables, which industry you're working in, all of that, those were and the returns to those in terms of consumption are likely to remain the same in the period in which I'm predicting. So that's something which is where employment market variables become the most important determinant of your income status or your poverty status. But this is a beautiful strategy simply because if there is anything that determines a household's income, then it is the household's participation in the labor market. So that's the most strong characteristics that we are looking at. So we are taking advantage of that one, and there is some compromise in terms of the stability of the model that is there. So we do that, and we basically predict it now for every year from 2017-18 to up to 2022-23. And these are the numbers that we get. So what we are getting is that from 22%, which is the poverty rate that we got for all India in 2011-12, if you are simply taking into account a multitude of employment-related variables from the PLFS, then your poverty decline is actually very negligible. It stays at around roughly 17-18%, roughly around that number. And that stays up to 22-23, which basically suggests that there is very little poverty decline that has happened after 2000. So that's roughly the number that I'm providing here. So what is the basic conclusion that we are coming to? We are really pointing out that there is a decline, but very moderate decline, not a decline that is being bandied about as that poverty has been eliminated and all those kind of things. Probably a decline, but not to that extent. By different methods, the range varies. The estimates in that sense are also which fit with the state level trends, and that's the new thing that we are trying to bring in. So we did the exercise at the state level. I'm not getting into the detail of it, but we are doing it at the state level, and therefore they match many of these things. But the beauty is that we are able to use the information that is available from the employment market one, and we believe that the employment data is really the best predictor of your income status or your well-being status, your participation in work, and that, if can be harvested, can be used for taking account and predicting what is happening to your well-being, then I think we may have an answer to this very ongoing debate as such. Not a concrete answer, but at least some information can be provided as to what is happening to poverty and inequality in India. But we need to do it with other secondary data, and we are in the process of adding more and more information into this secondary data. Ultimately, it has to pass the smell test. And I think that the employment data provides us an opportunity to do so. So thank you.
Right at the outset, I would like to thank the FAS, Madhura Swaminathan, Ramachandran, for giving us this platform to raise the very critical issue of microfinance loot of women in this country, which the organization that I belong to, the All India Democratic Women's Association, has been trying to deal with for a long time. This is 20 minutes, so 5 minutes each section I will try and take. And so firstly, as to why this issue was harassing us. Because as part of the work and activities at the ground level, in the last 10 to 15 years, we found that there was something else that was coming up as a day-to-day problem of women, and women seemed extremely distressed and harassed. And as we were probing further, some very startling examples came. And I will not place all of them because of the lack of time, but like for example, in Bihar, grandparents took microfinance loan for the granddaughter's marriage because the parents had died and they couldn't repay, so they jumped before a train and gave up their lives. In Maharashtra, a 6-year-old child, a daughter, was told by the mother when she saw the agent of the microfinance coming that please lock me up in this trunk and after he goes away, then you open it. The child went to play and forgot that the mother was inside. By the time the trunk was open, the mother suffocated to death. In Haryana, an MFI agent was told by the husband, you please take my wife because we cannot pay the installment. Similarly, lots of examples started coming from all over the country. In Karnataka, a Muslim woman, Mumtaz, her name has been changed. Her daughter was kept hostage by the MFI agent because she could not pay the loan. So similarly, everywhere we found that women were being extremely distressed. The reason basically being, especially post-COVID, during COVID and post-COVID, since there was absolutely no means of survival, women just didn't know how to run the houses. And because of that, and the MFI agents, this somehow just descended upon the villages like it was like vultures. Vultures normally feed on dead flesh. Here they were feeding on the living flesh. And they just roamed around the villages, luring women to take easy loans. The term easy loans was propagated without collaterals and with very less installments. And now somebody who needs money at that point of time had no option. And she just took these loans and then got caught into a debt trap. Then at the same time, we found that continuously the RBI was changing the rules to benefit the microfinance institutions. They were changing rules so that the loans given by bank decreased or rather stopped, and then the people and the poor and the farmers had no option but to go towards microfinance. So we also were dealing with the Reserve Bank of India, sending them memorandums, and the ceiling which was there on the interest rate, they removed the ceiling on the interest rate. So the interest rates were being charged something like from 22% to 102%. So it was a huge exploitation. But what we found was that these institutions were not at all receptive, were not willing to listen. And then the only option left before those who were victims of this loot, that we have to somehow raise this voice. You see, actually, this was not coming up. People were speaking a little bit about it, but it was not coming up in a big way. Like you talk of farmer suicides, but nobody was talking about women's suicides happening because of microfinance and because of this indebtedness. They were really caught in that trap. And so as a women's organization, we took this up in a big way, and we decided to have a massive survey in the country. And that survey was like a real eye-opener, because actually it was a very ambitious project that we took up. We decided to have a survey in 26 districts where we have our work, and it couldn't happen in 26 districts. Manipur, Kashmir, and Andaman, these 3 states we couldn't do, but 23 states, 9,000 women in 100 districts were surveyed. And these were are ordinary activists going around and villages and surveying. Now, in this survey, we came up with extremely painful kind of stories. And this survey was also taken in a very wide manner because we wanted to correlate. The government always talked about microfinance being empowering. They said it's empowerment of women. And that's where we questioned it. And we wanted to show how it was not empowerment. It was basically a loot. It was basically allowing a new kind of money lenders into the economic sphere again, in the villages and into the even city areas and all, and how they were manipulating the whole system to try and get more and more profit. So we conducted this survey for about a year, and then held a national public hearing in August 2025. We were lucky to have Justice Madan Lokur, Professor Prabhat Patnaik and others in this jury, and 20 women from different parts of the country placed their stories. The stories talked of indebtedness, harassment, humiliation, and also resilience. Because this is the first time they spoke publicly of what they were undergoing, of the unbearable pressure that they were facing because of these microfinance loans. And in fact, many of them said it was like a bursting of a dam. Many of them said that we were just hoping and waiting when somebody would hear us, when somebody would ask us what we are undergoing. And so in that public hearing, in these testimonials, what came out, the women, when they spoke, the women basically talked of, just 1 second, wait. Yeah. So I don't think I'll go into that because there are a lot of stories. You see, one woman said that I had to take a loan because there was sickness, a health problem in the house. Somebody had to take a loan to repay the husband's loan. Somebody took a loan because she had to pay back the loan of the earlier microfinance. So she got caught into a debt. And from that debt, she couldn't just extricate herself because all these loans are consumption loans. None of the loans have been investment loans. They're all consumption loans, all used up. Most of these women, 99% from the marginalized section, they have no work. They are Manrega workers, they are rural people, but they have no work. So no work, no earnings, cannot pay back. And so they were caught in that debt trap. And 60% of the women that we surveyed were from the rural areas, 40% were Dalits or Adivasis, 21% were from the minority communities, and 15% were single women or widowed women. And these are actually the ones who are historically denied access to any institutional credit. 70% of this were households that were under 10,000 rupees a month, and 90% were under 30,000 a month. So the women were so vulnerable to lack of money, and that's how they got totally stuck. The MFI, when they went there, they gave them option of, you pay monthly, weekly, monthly, fortnightly or monthly. Then they would bargain with the women as to how much you can pay back. Everything was to the whims and fancies of that company. So 32% had taken loans from over 3 companies. 60% had taken loans from over 2 companies. But there were some whom we found had taken loans from, even few of them, from 10 companies. And there was one incident that happened in Orissa where that lady committed suicide and she had taken loan from 17 companies. And when our activists went to that village, every single house in that village had taken a loan. So it's that massive. It's gone across. And 1/3 of these women surveyed carried a debt of more than 50,000, and 40% of them reported from 1 lakh to 2.5 lakhs. And they all said, we cannot pay it back. We just don't know how to pay it back. None of them were of any kind of hope that they could ever pay it back. And 50 to 60% of the women, though those MFI says no collaterals are required, they took jewelry, they took some house documents, they took the Aadhaar card and ration cards of these women so that they would be forced to pay the loans. But then the harassment continues, and taking away things from the house. They would stand outside the house and abuse the women. So, like one of the women, when the jury asked the lady from Tamil Nadu that the government says it is empowering you, then why are you complaining? She said, we did not take these loans to start any business or get rich. We borrowed only to survive, not to thrive. And we borrowed to buy food, to pay school fees, to keep the lights on in our house. How can survival become such empowerment? So very, very forcefully and with great emotion, women spoke about the abuse. Sexual abuse, women were a little very not forthcoming about talking about it, because they were afraid that if the people in the house comes to know, then it will be very difficult for them. But a lot of them on the quiet told us that they had to undergo sexual abuse from the MFI agent. Like sometimes they were being told, you send your daughter. That one of the agents would sit at the house, outside the house of that woman, till late night, 12 o'clock, 1 o'clock, till she would send somebody. Of course, she wouldn't, but that created in the basti, in the village, it created a very humiliating scenario for that family. And because of that, we find many women, in Bihar especially, we found village after village, women have just deserted the village. They've just left the village, they've just fled. They are in some insecure condition somewhere, but they're too afraid to come back home. And that is how we are trying to contact them, we are in touch with them, but they just cannot handle the situation and come back. So this is what we found in our survey. We found that the entire system, that the banks were earlier giving loans. You see, earlier, though women are approximately 20% of the small deposits in the public sector banks are of women. Now, what we find that earlier banks used to give some amount of loan to the women. Then later on, when the whole policy changed, nearly 494 corporate houses, they have been given loans, with loans more than 100 crores, and they get this at an annual rate, interest rate of lower than 5%. Now, these people, they have invested in MFIs. This is the same money that is flowing amongst the women with an interest rate of more than 22%. And then there is no limit. Anything can be charged. None of these women understand what is being charged. They only know how much they have to give back. When we sat and calculated with them, then they realized how much they are paying. So this changing in the priority sector lending norms in 2020 and 2025, the government allowed the public sector banks to fund NBFCs and MFIs. And because of that, instead the priority list changed. So the NBFCs and MFIs, they came onto the priority sector lending. Now, they had large amount of money. Now, in 2024, as of March 2024, 40,000 crore rupees was loaned to the MFIs and the NBFCs. Now, this was the large amount of money that was flowing, and of course, corporate money is also coming in. Now, the government policy, it facilitates the outreach of the non-banking financial institutions and MFIs. Now, what is happening? So, the rules allow the banks to allocate 15% of the individual funding to large corporate MFIs. Now, when and any MFI who has more than 500 crores, worth 500 crores. So the policies of the RBI has been continuously trying to facilitate the growth of MFIs in the rural areas especially, because the rural regional banks have withdrawn from the scene. And what is the scope of monitoring? How do they monitor? It's a very strange kind of regulation of the RBI, where it has said, there is the RBI's Master Direction 2022, which we opposed and sent a detailed memorandum to, of course, which we never got any reply. Neither did we get an appointment of the governor. So they formed the organization called Self-Regulatory Organization. That means the MFI will regulate itself. And it will make its own rules and monitor the progress of the institution. Now, this is a very strange thing. So, there are the thing has been formed at present. The Microfinance India Network, this has been designated as a self-regulating organization in 2014. And then there is the Sadhan Consortium, having 220 NBFCs and MFIs as its members, which was recognized as a self-regulating organization in 2015. Now, none of these, obviously it is your own institution that you have set up to regulate you. How are they going to take action? There's no complaint mechanism at all. So there has never been any action against any MFI up to now. And oh, really? Okay. Yeah. Okay. Okay. Oh, I really didn't look this side. Okay, so anyway, so on the whole, these are the things, but some alternative models of credit are also there, which need to be popularized. One is, of course, the NABARD Association is fighting for the strengthening of the SHG bank linkage, which has been now quite weakened. In fact, now the government is bringing the Bula bill, that is banning of unlawful lending practices, and it's going to include the self-help groups in that. So the self-help group entire movement is going to be totally demolished. Then there is the Mallar Association, which has been running for 30 years. And it has had a fantastic SHG movement going on, and of course, the Kudumshri. But I'm not going into it because that alternative policies, I hope you speak on that also, because the Kudumshri movement in Kerala has been has had a positive impact on women's lives. There was one lady who spoke from there, and she talked about how she became an entrepreneur because of Kudumshri. She was an extremely poor woman who didn't even have food to eat, and how Kudumshri gave her a loan of 500 rupees first. And with that 500, now she runs 3 hotels. So how it helped her instead of looting her. The MFI does the opposite. So I would request you when you speak about this. And when I went to one Kutumshri meeting, just one Kutumshri meeting, a very simple thing. In that meeting, we just asked women, how have your lives changed? Now, that lady was not very well educated. So an ordinary woman, she came and she said, I can only say this. Earlier, my hand used to be like this. Now, my hand is like this. So, I mean, you know, it's sense of pride. And so we have made demands that the banks must give loans at 4%. The MFI, there has to be regulation and accountability to end their exploitative practices. There has to be a curb on the interest rate. There has to be a grievance redressal mechanism. And public sector must address the needs of the women from the marginalized sections amongst the other demands. So we are having state public hearings. We are going to have public hearings in nearly 23 states, and we'll ask FAS also to join us some places, so we can have a very interesting collaboration and see how this can be taken further, because we'll have to fight. The government is not going to listen so easily, but I'm sure we shall ultimately hope to get some change. Thank you, and I'm sorry, Ritu.
Thank you, Mariam. That was really, I mean, makes one really, we're not shocked but furious, I think, at the way the financial architecture and monetary architecture is functioning. Ruchira, you have your picture?
Okay. Good afternoon. Uh, so let me first apologize because what I'm about to present is not a full-fledged paper, but it is kind of a scattered presentations from different places stitched up into a form of a paper and submitted. So there may be some incoherence somewhere, and I am looking forward to your comments at the end of it. So what we look in this presentation is the poverty alleviation trajectory of the Southeast Asian countries, rather select countries out of the Southeast Asian region, in the context of rural development. And while we still talk about poverty, as we see that there is still very high levels of poverty globally, around 831 million people under $3 USD per day. When we look at the multidimensional poverty, 1.1 billion people, or every 2 persons at least in every 10 people are still in acute MDP. And consistently we see that the concentration of poor is in the rural areas. And Southeast Asian countries, a select of them have achieved substantial poverty decline much faster than their neighboring regions of South Asia, and although with some variations within and between countries. And there are significant learning for Southeast Asian countries as we have a similar kind of start and trajectory, although similar structure and start, but different trajectory of poverty alleviation. We look at Southeast Asia because they offer a combination of examples of economic transformation, targeted social protection, and inclusive rural development. We also look at them because we can learn from them. They started at a very high level of poverty, much higher than the present day Sub-Saharan Africa, but then showed remarkable achievements and went down below the global poverty line, and they did it much faster than the South Asian countries. They surpassed the global average back in 2007, whereas it took us another 13 years to do the same. And they also faced significant barriers very similar to us. They had the Asian financial crisis, similar IMF bailout for them, structural changes that were required of them, but despite all of those, they have shown very fast trajectory moving out of poverty and a large number of people moving out of poverty. So we try to cover the trajectory of these countries, how they have come out of poverty, the policy measures in terms of social protection that they have taken, and what kind of cross-cutting insights can we learn from these countries. If we look at these select countries, I've specifically taken Indonesia, Malaysia, Thailand, Vietnam. Myanmar is there in the table as an example, but we have left the countries which are, there are too many of donor-driven programs because there are risks of learning from donor-driven programs. So Indonesia and Vietnam are the two bigger countries in terms of population. Rest are small countries, 35 million, 71 million population. We see that their poverty ratios in terms of percentage of people who are under the $3 poverty line. It's almost zero in Malaysia, zero in Thailand. Indonesia and Vietnam, there are 5% in Indonesia and 1% in Vietnam. MDPI is also very low in Malaysia and Thailand, whereas in Indonesia we see that around 5% people report that they have some kind of inadequacy. In Vietnam, it's 1.9%. When we look at their annualized growth of per capita consumption, remaining countries, Indonesia, Malaysia, Thailand, Indonesia, Malaysia, Thailand, and Myanmar, we see that for the bottom 40%, there is the growth of per capita consumption is much higher than the overall average growth of per capita consumption. In Vietnam, however, we see that the rate of growth of per capita consumption for the bottom 40% as well as the average of the entire population is almost similar. In fact, it's slightly lesser for the bottom 40% population. And that has some implication because when we see the inequality figures, the Gini figures, Malaysia, despite a very low level of poverty, the inequality is very high. Same in Vietnam, where we see that inequality is 0.36, the Gini coefficient is 0.36, and with the other programs. So there is success in poverty reduction, but with high inequality, that is something evident from the data. Moving forward to the trajectory of decline, and as this is just the global figures, that there has been an overall decline of poverty, and when we see the World Bank figures of how the regions have performed in terms of poverty decline, as I was saying earlier, the regions of Sub-Saharan Africa, Eastern and Southern Africa, Western Central Africa, they have always been above the world average, whereas European regions and earlier Latin America and Caribbean, these were always below the global average. The regions that have actually surpassed global average and come down are the South Asian regions and the East Asian Pacific, and within that, East Asian Pacific has surpassed it much faster in 2007. So there is something to learn from these countries. And if you look closer, so I'm just zoomed in into this picture, we can see that the trajectory is much faster. And they started with nearly half the poor in the world, so very high levels of poverty. And then between 1981 and 2021, they came down to less than 5% of global poor. Very large number of people moved out of poverty. And they surpassed, as I was saying, much faster than South Asia. Although the regional pattern is, very impressive, but there are wide variations within the country. And we see that there has been steady decline in Thailand with near zero poverty line. Low levels of poverty, but stagnating poverty decline after 2010 that we see in Indonesia. We see sporadic data and fluctuations in the levels of poverty in Vietnam, and as we talked about in the earlier slide, that the shared prosperity performance, the bottom 40%, the growth of bottom 40% income is actually less than the average growth of income or consumption. Now, this is a review basically, and when we review the policy papers and the discourse, and we see that what are the primary issues that are being talked about in the policy arena, and that are focused, and we kind of divided into 4 categories. One is the ones that are more discussed in the pragmatic context, so there are more action-driven discussion, and these are rural development, poverty, agriculture that are mostly in discussion. There are issues that are discussed in terms of theoretical development, but not in the pragmatic context. And these are basically climate change, community resilience that are discussed. Then there are the issues such as land reform, microfinance, livelihoods, which are very frequently discussed in the pragmatic context, but not so deeply explored as a concept. And then finally, social protection and income inequality, which we see are actually declining theme in terms of their prominence in the policy discourse. And in terms of their spread, like how long they have been discussed as well, we see that rural development, food security, poverty, these have been discussed for the longest of time. Now, when we review the literature and kind of try to simplify the approaches to poverty reduction in these countries, we see that we start with Thailand, and we see that they also had, at the core of the Asian financial crisis in 1997, and that was the major jolt that they faced. Currency collapsed, government changed. They had to accept IMF bailout and accept structural reforms. But at the same time, they also expanded their social protection coverage. And this is also the same time when the idea of social protection globally was understood in a different context. So from pensions and transfers, social protection was ideated as a much bigger thing that will cover all aspects of human dignity and human development. And this country also covered, increased the social protection coverage with unemployment benefit. They went for universal health care, non-contributory pensions, and also a very significant investment in through village fund for the rural areas. Thailand also had something called a contract farming. There were legal structures. We'll discuss it in a bit, what the implications were. Coming to Indonesia, they were also affected by AFC. Unemployment increased initially, and then they started working on increasing their domestic demand, and there were major socioeconomic upheaval in Indonesia after that. They took multi-pronged social protection policy. They also went for price protection for their farmers. There were many means-tested cash transfers that were introduced, linked extensively to health and education, so they focused very much on the demographic dividend. There was one problem of this missing middle in Indonesia, which is also an issue in Malaysia, Vietnam, and Thailand, but mainly in the aspect of Indonesia, it's talked about more, which is basically people who are formally employed and can be covered in contributory programs were covered in social protection. People who were poor and therefore eligible for subsidies could be covered in some type of program, but there were these people who were in informal employment, therefore not poor enough for subsidies, but they could not be covered in any of those programs. So this missing middle was a major concern for the Indonesia, and which kind of is what is linked to its inequality figures as well. The other issue with Indonesia was the fiscal limitation. Their tax to GDP ratio was not very high, so although they went for extensive health and education transfers, but how they will kind of continue that, there was always a question on that. So there was a time when the energy subsidy was kind of reduced and social protection was increased. So this kind of a trade-off was thought about because of their fiscal situation. Coming to Malaysia, similarly affected by AFC, which is the financial crisis, they also worked towards expanding the domestic demand, and they provided multi-pronged support to farmers, starting from provision of resources, infrastructure, credit, and skill. And Malaysia is the one country which has very strong price protection policy, something, although not MSP as such, but something similar to our country, where they actually don't have the middlemen and the state directly protects the prices. Then Vietnam had high rural poverty and very high informality challenge. They still have the informality challenge, so reaching out to poor in the rural areas is a huge challenge for them. Although in all these 4 countries, the proportion of people who are living in rural areas is declining over time. So from more than 50%, it is coming down. So now it's a quarter of population in some of the countries. And the rural credit was kind of something that they focused on, increasing non-farm income. Vietnam also made conscious transitions from subsistence to commercial agriculture, so that there is more cash income in the hands of farming households. And there is something that is we see in the Vietnam's case, which is the focus on creating this new rural areas, which is like extensive investments in infrastructure in the rural areas, building the canals, building roads, providing assets to the poor people. So they're in most of their social protection policies and investments, they put a lot of emphasis on providing assets to people. So this can be public assets, roads, infrastructure, or irrigation infrastructure, or these can be private assets as well. So that is a major focus of Vietnamese policy. They did discuss price protection around 2024, but it was never implemented, kind of dropped after discussion. So the key words that we come across in these countries are basically price support mechanisms, either through floor prices or some procurement prices, some sort of input subsidies, energy subsidies or fertilizer subsidies, credit facilitation through government-backed loans, and when we talk about the the contract farming, we will talk about it, storage and stock management by state agencies, agricultural insurance with government subsidies that we see in Indonesia, Thailand, and Vietnam. Contract farming frameworks with legal protection. Now in Thailand, we have this massive contract farming provided to the farmers, and there are a lot of divergence of opinion as to how that contract farming has worked out. And initially when the contract farming was pushed, it was said that this will be a perfect way to build the agribusiness up, and that will be driving the economy forward. And to some extent, probably it did, but there are also a lot of evidences where it was found that definitely the credit for farming is basically coming from nationalized banks. So it's basically public bank providing credit to the farmers, which ultimately provides low-cost input to private corporations. So it's kind of a I don't know, the channelization of the public money into the private hand. And although it's supposed to be equitable for both the farmer and the corporation, but when we look at the evidence, actually it's the corporations getting low cost input, and in reality there is a loophole that they can use to even come out of the legal protection of litigations where the government actually can intervene, which is the 10 farmer threshold is 10 farmers. So it's only a contract farming when you are making this agreement with 10 farmers. If you are making the agreement with 9 farmers, then there is no legal protection for you. So ultimately there is a loophole through which the corporations can always come out. So although contract farming was pushed a lot, but they had to create a large number of other social protection policies to again protect the same people from whatever is the negative impact of these kinds of vulnerabilities. There is also something in the Vietnamese context as well as in some other contexts, as I was saying, a lot of emphasis on new rural. So creation of these new rural, Dana Desa or something. So they will create a lot of infrastructure in the villages, transfer assets to the villages, create road infrastructure, irrigation networks, and link it with employment, link it with public works. So not exactly MGNREGA, but something similar to this, where assets will be built through employment. So this kind of emphasis is also there, and through which a lot of multidimensional poverty could be reduced in these countries, because assets were directly created, both public and private assets, through these programs. So when we look at the country-wise sectoral distribution, we see that in So this is again what we see in the literature, how it comes out. And okay, so I'll just quickly go through it. And we see that Indonesia, Vietnam, Thailand basically had healthcare and a lot of universal programs. Whereas in Malaysia and Indonesia, we see more means-tested cash transfer programs. Vietnam had this infrastructure as the main emphasis, a lot of infrastructure programs. So this is the main difference, and at least 13% of these programs across the countries were universal in nature. So no means testing, anybody can access it. I will not take you through all the programs one by one, but these are the major ones. So there are a lot more which is there in the note that I have submitted, but I just wanted to focus on the major ones. So in Thailand, other than the contract farming, to then protect people from whatever is the impact of that, they had this universal coverage scheme for healthcare, which covers almost 74% of the population. Old age allowance, and you see the timeline, it's almost introduced around the GFC, so they really learned that when there is a crisis, you need to kind of protect the local, domestic demand, so all sorts of cash transfers around the 2007-8 that we can see here. And for citizens of above 60, they created these cash transfer programs, again universal, and this targeted microcredit, which is the 1 million baht village fund for enterprise financing and rural community development. In Indonesia, they had this new rural development program. Again, we see this word a lot in these Southeast Asian countries, new rural development in all these countries, and it's all linked to this infrastructure creation, and in Indonesia, health education. I'll just straight away go to the summary actually. So basically it's all health, education, targeted subsidy, universal grants to create number one, demographic dividend, and number two, assets in the rural areas. To kind of straight away go to the observations, we see that and I'm not saying that we are learning what to do for poverty alleviation, but there is no harm in looking at people who have alleviated poverty and see what they do with their public money. So in that sense, if we look at this question and then we see that larger economies with low poverty, they have more comprehensive agriculture protection policies, they focus on agribusiness and have multi-pronged and universal social protection systems. They rely on targeted donor-funded interventions. So the neighboring countries which are not as good, there is a lot of donor-funded interventions like Laos, Cambodia, etc., and not much to learn from them if we are looking at the state-run protection policies. There is strong emphasis on health coverage, education, both targeted programs and universal health programs, and tailored towards middle and low-income groups with preeminent programs such as those facilitating economic resilience, added goals of skill development and enterprise creation, which is something that we see increasing after the 2020, the COVID ended, and rural infrastructure creation. There are some critiques to it as well. There are some challenges as well. First is this huge informality challenge. So how do you reach out those who are not covered in any kind of social security numbers, they are not in any formal employment and not poor enough for subsidies. So most of the rural then remain out of coverage in these means-tested programs. Program design also, although universal programs are impactful and most studies say that they're impactful, but then how to kind of continue them, and then limitations of private partnerships for this agribusiness development, as I said about the contract farming, and there is also gender regional inequality, as we say that at least a quarter of women and youth in these areas are NEET, which is not in employment, education or training, so how to kind of include them. So with this, I end my presentation and look forward to your comments. Thank you so much.
Thank you so much, your presentation, so much to learn from, I think, and take inspiration from yours now. So now from the broader perspective we have at the Kerala level, what are the strategies used?
So at the outset, let me thank FAS for giving me this opportunity to present the case of Kerala. In fact, this is not a review paper. This is basically an account of what has happened in Kerala the last 4 years to specifically target the extremely poor and come up with a program which would emancipate this almost about 64,000 families from extreme poverty. There has been great debate over this ever since it has been declared in the public as well as in the press and also from the political parties regarding the veracity of this methodology, how you are going to sustain this, etc., etc. I think I am. It is basically an account of the whole process of extreme poverty identification and eradication. And this is not a review. This is not a research paper, for that matter. So, in fact, I think I just wanted to put the entire exercise in the context of Kerala's development. As you all know, there has been historically several interventions on the part of the government, particularly policies that have been laid much before, even since the inception of the state, so that there has been concerted efforts for socio-economic development, as you can see here. There had been the agrarian relations bill, education bill, and so and so. I think the history of Kerala is known to almost everyone. And this has paid off so well, and with our indicators of socio-economic development do vouch that Kerala has been able to accomplish many things, particularly in literacy and education, healthcare, poverty, per capita GSDP for that matter, digital literacy, and of late sustainable development goals. Kerala has been ranking. I mean, has been emerging as the first state in the SDG index for 4 consecutive years. So poverty in Kerala basically was significantly higher than the national average in 73-74, and it came down in the 80s with 51.5% in Kerala against, even in the 1778 it was 51.5% in Kerala, while nationally it was 45.2. And in 1983, Kerala's poverty rate had fallen below the national average, and as of now, Kerala is the least impoverished state with 0.55% in 2019-20, a decrease from 0.7% in 2015-16, according to statistics of the Niti Aayog. And this is a graph, and this is how the poverty status of Kerala vis-a-vis that of India. And we would also have a brief review of the various poverty alleviation programs in Kerala. We had all the centrally sponsored schemes. We had the community development program. We had the Swarna Jayanti Swarozgar Yojana. Many of these programs have focused on different dimensions of poverty, but they have not comprehensively addressed the entire gamut of extreme poverty, basically. And MGNRGS, for that matter, we are one state which has been doing it so beautifully, I would say, because MGNRGS allocation every year has been increasing, and we have targeted better employment opportunities for the rural poor through MGNRGS. And Hunger-Free Kerala and National Food Security Act were also efficiently implemented by Kerala. So, apart from this centrally sponsored scheme, we had state interventions, exclusive state programs. We had the Kudumbashree, as she said. Kudumbashree has been contributing substantially in eradicating rural poverty. And Kudumbashree, in fact, has become an agency which can lead many other community-led development programs. They are entity, it has evolved into an entity which can lead many other programs. Even this this extreme poverty eradication program also was implemented under the leadership of Kudumbashree. So in 2002, we had a program called Ashraya, which was again a Kudumbashree-led poverty alleviation program, where food, health care, and education were targeted, and households were selected based on deprivation criteria. Micro plans for providing food, health care, and education of children were also formulated at that time. Now, coming to the shortcomings of these previous programs, the first and foremost thing was that these programs did not focus, as I said earlier, the different dimensions of extreme poverty, and also the coverage of requirements were not very comprehensive, and they were implemented by either one or two agencies. And most of the transferred institutions, particularly transferred to the local governments, were not involved in that program, and they were not monitored properly. And as a result, we have found there had been islands of extreme deprivation in Kerala in spite of all these interventions. So defining extreme poverty has been a difficult task, as you know, because most of the criticisms against the extreme poverty eradication program had been around this. In fact, this has been a very functional definition of extreme poverty. It does not have anything to do with the kind of definition that we traditionally give to poverty. In fact, we had defined poverty as those households which are destitute, unsupported, and helpless. Those lacking the capacity to secure even basic entitlements and are unable to sustain themselves. And these maybe 5 criteria were applied in identifying the extremely poor households. So there's going to be, I think, there's going to be a lot of debate over this. Statistically, there could be issues with regard to the estimation process, but this has absolutely been a functional program where it was for convenience and it was realizing the ground reality that the government decided to define extreme poverty this way. And extreme poverty eradication program, I would just spend a few minutes to describe how the whole concept got evolved. The identification was based on an MPI framework, that is multidimensional poverty index framework, which was, as you know, developed by the UNDP and also the Oxford Poverty and Human Development Initiative. Niti Aayog had also come up with this MPI indexing in between. And we had adopted the various criteria listed by MPI, and we added some of the criteria which we had used earlier in the Ashraya program as well. So there has been almost a set of 38 criteria to define to characterize the household based on various expressions of poverty. So this is the framework of the UNDP, and it's not very clear. So in fact, in this process, we had adopted 4 criteria: food and nutrition availability, health, income, and place of residence. And we also considered the historical vulnerabilities of the scheduled caste and scheduled tribe. Specific criteria were set apart for these 2 categories, and for the fishermen and coastal communities also. And social vulnerabilities were also considered: HIV-infected, poor families with orphan children, then LGBTQIA+, and so these social vulnerabilities were also considered in identifying the extremely poor households. So eligible households, in fact, was identified through a process of consultation with the neighborhood. There had been citizen databases, particularly databases of the Ashraya program. There is a list of households who are beneficiaries of the Ashraya program, and a list of households who were beneficiaries of the MGNREGS, list of households who are beneficiaries of the public distribution system. So all these citizen databases were compiled, and there had been focus group discussions to identify which household has been experiencing the extreme forms of poverty. And there was some kind of a wealth ranking kind of a participatory appraisal which we have done in this process. And a preliminary list of 118,309 families were prepared following 58,964 focus group discussions involving social organizations and subject area experts. In fact, the volunteers of the Kudumbashri, the local government representative, an official of the department, and those volunteers who had expressed willingness to be part of this program were part of this identification process. And the organizational structure also has been a very formal one. There had been a committee at the at the panchayat level, there had been committees at the district level and also at the state level to monitor various activities of this process. And this list, which was prepared by these committees, was compared with the list of Antyodaya program. Antyodaya programs, you know, and palliative care program and the differently abled beneficiaries to ensure that those people who have been included in this list are not omitted from the new list which we have prepared. And this committee supervised the data. There had been monitoring of the public, some kind of a social audit to ensure that all the eligible households have been included in this process. And district level committees were in charge of training and providing support, etc., to various other committees which were functioning at the Grama level or the Panchayat level and the ward level. So you can read through these slides. And they convene meetings, they manage collection of data, they super checked many of these lists that prepared by the committees, and they address queries. So this has been the functions of the district level committees. There was also a state level coordination and monitoring committee, and under a nodal officer who monitored all these other aspects of the program and providing feedback very frequently about the success of the program, because the deadline was already fixed and we had to race against time to see to it that all these households are covered. So I think a little bit about the methodology again. The factors which contribute to extreme poverty were classified into two. There are distress factors which are extremely severe and severe distress factors. So I told you we had taken into consideration 4 basic dimensions of extreme poverty. And each of these dimensions of extreme poverty was again defined or again divided into different sub-dimensions. And one example of sub-dimension is provided here. See, in the case of food availability, there are 2 cases which can be considered to be severely distressed or extremely severe distress. Families who are unable to cook on their own or buy food from outside due to old age or physical. So this condition would be regarded as an extremely stressful condition. And distress factor, which is not very severe, is families with children aged 6 or below having severe acute malnutrition. So the computation is like this. Any household which experiences any one of these extremely severe distress factor will be given a score of 10. And any household which has experienced a severe factor twice or 2 severe factors will be getting 5 plus 5. The score given to the distress factors, which is less severe, is 5. So 2 severe factors would fetch them 10. So any household which is eligible to get 10 as a score would be invariably included in the list. So that means all these dimensions which I have listed, or dimensions of poverty which I have listed here, plus the various characteristics of social vulnerability and historical vulnerability would also be considered. So I would explain those things a little more later. So healthcare, these are the different stress factors or distress factors. It is going to be finished now. Severe distress factor, income level, this is the classification. Place of residence, this is the classification which we had adopted. And social vulnerability, again, these 2 particular characteristics were considered. People are who are threatened by the sea, or families with no one educated above. So I think I don't get into the details. Historical vulnerability has been defined this way: scheduled caste and scheduled tribes. And social vulnerability, HIV affected, family with orphan children, LGBTQI, etc. And how do you differentiate between the poor and the extremely poor? The extremely poor could be a family which is wandering the streets without a land or a house, unemployed family without a ration card, a poor family that is unable to work. So this is how we had defined the concept of extreme. This is how we differentiated between the poor and the extremely poor families. So outcome of enumeration was this. So 73,747 families were prepared, and 20% super check was done by the Department of Economics and Statistics, and those local governments which had 5% variation were again subjected to thorough re-enumeration, and that was how this number of 64,006 households were arrived. And in these 64,006 extremely poor households, there were 1,03,099 individuals. It comes to almost about 0.5% of the extremely poor, as given by the Niti Aayog statistics. So again, 2 more minutes. Based on the requirements of these households, the local governments were asked to prepare microplans. So those who did not have food would be provided with food, Those who did not have medical care would be immediately provided with medical care, and those who were not were entitled to have identity cards, etc., would be provided with that facility immediately by concerned department. So it was a concerted effort jointly by every department involved, not only those who have been transferred to the local governments, but also departments like agriculture, transport, higher education, all the departments had been contributing to this program. So this is the structure of the micro plans. We wanted to assess the families and develop micro plans, implement the micro plans, and monitor that the plans have been implemented by the concerned agency. So I think these are all the other statistics, that the different types of services that have been provided. Food assistance was provided to 20,640. That does not mean that food assistance is provided only for a period of time. No. Food assistance would be continuously provided by an agency. Here, Kudumbashri would be in charge of that. So health would be continuously provided by the public health center. That would be aided by the concerned local body. So it is ensured that a household would be getting all these facilities and services, goods, whatever they require, constantly without any interruption. So medical assistance, income livelihood assistance. So the way forward is a big question. We have to ensure that these interventions would sustain. We have to ensure that there should be a dedicated mechanism to see to it that these interventions would continue. We should also prevent people and families from falling back to the depth of extreme poverty. We should have constant vigil on the society to see that those vulnerable families would not get into the extreme poverty trap. So this is all about the extreme poverty eradication program, and this is the saga of Kerala's momentous effort to eradicate extreme poverty. Thank you.
Thank you so much for these four papers, which are really, I think each one made such strong contributions, whether at the micro level or the international level or the meso level. So identifying issues and yet at the strategies of how to deal with them, I think from which there can be a lot of learning. So I think now we can have a round of questions, clarifications, disagreements, whatever, collectively to all the speakers or individually.
So, hi, I am Atmanathan. So, I have one clarificatory question to Jiju sir. So, sir, you mentioned about micro plans. So, I was just wondering, was it a committee in the local body level, or was there a different institutional setup to draft such plans, or was the state government themselves, they brought new bureaucratic in that plan like that? So, yeah.
Yeah, Vinod Abraham here. So, 3 questions. One is to the last person, Jiju P. Alex. I mean, it is laudable that the Kerala government has been able to do this. But what is the strategy? I mean, you said that poverty has been eradicated by state government funding. But are they sustainable in terms of what is the sustenance of such a model, both on the state government's finances and also on the livelihoods of these people who are now provided with what is the immediate requirement, but probably not provided with the livelihood that they should be getting into. So maybe that's something that you can reflect on. To the presenter on to Ruchira, what is the learning that we are getting for India? What's the learning that we are getting in terms of poverty eradication? I think one of the important things that you had showed was across these countries, the price support that was given in the agriculture sector. Across all these 4 countries that you were talking about in the agriculture sector, price support was the thing. We do have a price support system. India does follow a price support system, but why hasn't it had so much of an effect when you look at these countries, these 4 countries that the East Asian economies? You don't see that kind of an effect in the in Indian case. Is there any comment on that? And thirdly, thirdly to Himanshu, yes, again, as the last question to Himanshu, yes, again, as you have estimated that poverty has had some dent, but not as dramatic as being is shown in the data. Now, you have used a method, the team has used a method to project what would be the a method to identify what would have been the poverty rate based on the wages and employment or the PLFS data. Right? Now, what is the consumer? You have also done work on consumer expenditure services. That does not show this kind of a trend at all. Why is it that gap that is coming up, the consumer expenditure service and the PLFS data that we have? Yeah, that's it.
Thank you. I wasn't able to hear all of the papers because I was been in another session, but I wanted to ask, I heard the first 2. Himanshu, I just wanted to ask you where you ended up in, what's your criterion, what is your definition of poverty eventually? I think it's really important that we get these assessments and reassessments and we think about what sort of progress is being made. But I wasn't very clear in the end where you ended up on what the basic criterion was or what level of poverty we're actually looking at. And then the paper on credit was quite shocking again because we had a whole lot of discussion about when this first emerged in Andhra in about 2012 or 2011, sometime way back then, when I thought there was a lot of outcry and a lot of redressing and a lot of understanding that this was something that needed to be controlled, and it was. Now what you're suggesting is that it has become really widespread, not just Andhra, not just a few states, but all over, and it doesn't sound as though you're making much progress in terms of getting any redress. And I wonder what you think about the possibilities for getting any action on this front. Thank you.
No,
More questions on finance and on the microfinance issues? You want to go there and talk? Or
no, this is all right. It's okay. So, in Andhra, when the suicides happened and when there was an uproar, then there was a lot of pressure, and the Andhra Pradesh government brought in a law to try and control the situation. But after that, as you see, the laws, the government policy has been changing, which has actually encouraged MFIs. But so that is the policy changes which has encouraged MFIs on the one hand. But on the second hand, because of public protest, because of women coming out on the roads, we find today Karnataka, Tamil Nadu, Andhra, and one more state, they have brought in regulatory laws. In fact, Karnataka has passed the law, Tamil Nadu has also passed, but the states have passed laws where they can regulate and see to it that they stop the harassment by the MFIs. But actual policy level is taken up by the center. So that is why that is where they are not intervening, like curbing the interest rates, etc. So there's a two-pronged struggle going on. Now 4 states have certain laws. We are pressurizing to see to that all states do. Because we know that the central government today is absolutely, you see, unresponsive. So at least we'll try at the state level, and then maybe sometime we go to the center and pressurize them. But it's the movement only that brings that pressure and forces the state governments to make these laws. And of course, institutions as these, when you are sitting on various forums to raise these points so that some discussion is held on it. That's the way.
No, so let me quickly answer your question, which is correctly pointed out. In fact, the idea of moving to PLFS came from this, because the consumer expenditure survey has limited number of variables. I mean, other than the demographic variables, the only other information that you have is various items of consumption. So other than the stock variables, which are the demographic variables, there is not much that changes. I mean, your caste doesn't change, your gender doesn't change, your various things don't change. So there is more or less not variation in that sense. The other variable that you can actually add is what mostly people use, is durables, which again is a very weird kind of a variable, because that also doesn't change quite much, and it is concentrated in the top, not so much in the bottom, so not very good. That is where the idea of using the employment variables, because they are the best predictors. And what we find is that if you look at other way around, look at the predictability of the models, employment characteristics can actually predict your status much more than, say, for example, access to durable or access to assets or simple household variables. And that is why the PLFS ones show a different result than the ones. And we were purposely trying to introduce the employment variables in this whole debate, saying that this is something which is coming out, and then we need to be actually asking those questions. To do this question, that's the beauty of this method, that because it doesn't basically depend on a particular poverty line. So we have actually done it with all the poverty lines that is possible. So if you say, for example, this is from the Tendulkar poverty line that I showed you. If you take the Rangarajan poverty line, the levels are higher. And if you take some other poverty line, it goes up. But because the poverty line is defined only in the initial period, rest is, so the same poverty line is carried forward there. So therefore, you can do any poverty line. So that it doesn't basically, because one of the problems that we are facing is that the 22-23 data, the consumption survey that came out, that is not comparable with the previous one. And therefore, there is no defined poverty line also. The Tendulkar poverty line cannot be applied on this MMRP estimate of it. So that is what was troubling us, as to which poverty line to use, even if you wanted to. So therefore, this method basically absolves us of all these complications. No poverty line needs to be defined. Whatever is there in 2011-12 is the valid one that can be taken forward, and all other complications that we talked about. So this is just a way of, in a sense, we are trying to introduce that element of employment characteristics, earnings, and quality of employment, which we have multiple criteria, into the debate, saying that those are rather uncontested, less contentious in that sense. The data quality has not changed much. And there are multiple data sources which are telling you the same narrative, which basically are confirming the basic story which coming out from various data sources. That was the whole idea of doing this exercise.
To your question on what are the learnings for India, and then why no impact of MSP in general. Just one correction. Price support is not something which is uniform across the 4 countries. Other than Malaysia, the other 3 countries do not have an explicit price support system. Vietnam has none, but other countries have some floor price that is being announced by their ministries, but not like Malaysia, where there is actually the state supporting procurement and all. But if we are to learn something from these countries, which is kind of consistent across all these successful countries, is that they have had a consistent investment in demographic dividends. So in education and in health, we see that there is a lot of focus on that. Health is universalized in all these countries, as is that there is a focused transfer towards education. So nudging the households to send their children to school and keep the children in school. That is something that we can see, which is common in all these countries. And one more thing is creation of these rural assets, which I was saying, this idea of building a new rural, so transferring assets to the rural poor. And beyond MSP, there are a lot of things, so which is something that the paper also focuses on, that there has to be a multi-pronged approach, kind of creating social protection where it's needed, either through means-tested methods or where it's needed, universal methods. Unless this set of protection is created and this consistent investment in these areas is created, then I don't think there will be any impact to see or learn from. Thank you.
So your question regarding microplan, basically you have to understand the whole process of decentralized planning to explain these things well. In fact, I did not attempt to do that because it is going to be very lengthy and complex. See, we have a decentralized planning process where the local governments are given almost about 30% of the total plan funds. And that comes to, this year it has been 9,700 crores. And next year it is going to cross 10,000 crores. That means every local body, particularly the Gram Panchayat, would be getting money to the tune of 9 crores to 10 crores every year. And they are sufficiently capable of doing these activities. So microplan is nothing but a project which is formulated to address an issue which we have found out in this extreme poverty eradication program for a household. So for example, there are 10 households which belong to this category having an issue of food. Then those 10 households would be taken together and a project would be formulated by the local body to provide food to those 10 households, and money would be earmarked for this purpose. So that will be done by an implementing officer who is transferred to the local body. So likewise, in all these 35 sectors, you can formulate any number of projects. So this project would be implemented by the local government, maybe getting assisted by, maybe being assisted by Kudumbashri or the designated office, and that would be continued. And they have the flexibility and freedom to spend that money. So that is, again, that would explain your query as well. State finances is not, there's not going to be much burden on the state finances. As far as this particular program is concerned, we have given only 160 crores to the local self-government department to conduct this program as an annual plan. And rest of the money was met from their own sources. So every year, out of the plan funds that they get, these local governments would be able to do this. And I also, I don't have the correct figure, maybe at the most, maybe 300 crores or so, the local bodies altogether might have spent in this program so far, in the last 4 years. And regarding sustenance, as a big question, I think there is going to be a sequel to this program. The program is being formalized, and I think there is going to be a dedicated mechanism to monitor whether these households would go back to extreme poverty or new vulnerable households would again get into this extremely poor, extreme poverty trap. So that is something which we have to figure out. So far, we have not been able to formalize any such mechanism. We will be able to do that. Livelihood, in fact, many of the other factors of deprivation, lack of livelihood was also one factor. And those households who are capable of taking up a livelihood activity were given such options. So that also would be taken care of. It was a differential treatment to different households based on the kind of poverty that they suffer. So they differ from every household. Each household will be having its own solutions. That is how we go about. Thank you.
Any more questions? Yeah, anyway, we have extended this, our session by another 10 minutes because the next session after that is only at about 4:30. So we do have some time. Today, I'm really very happy that we've had these very 4 different kinds of presentations from different perspectives, but with a running thread of concern for, general well-being in that sense of the term. So we've had an academician, Himanshu from JNU, Ruchira from the National Institute of Rural Development, which I think they have closed down, or they're planning to close down, the central government. We have Mariam at the ground level really working on these fundamental issues. So we have an activist perspective. And of course, we have Jiju with us, who's on the state planning board. In fact, please remember, Kerala is the only state in the country which has a state planning board. We have another member, Minnie is here. Sukumar, you're in charge of gender and school education. Okay, so if you'd like to add something, if any 4 of you would like to add something that you feel you left out because I was too strict, for about the 20 minutes. We still have about 3 or 4 minutes for that. Anything? I would, okay, then, in fact, I had several questions which I will not, of course, articulate or put forward. That's for discussion later on, which we can really do. Like I found yours, the instances were really very horrifying. And it's come up in many, many kinds of places which is there. So maybe, several of us can work together on these issues which you have raised at the ground level. And of course, take the analysis which has put forward, all the learnings which we have from you. And I think the practical implementation, without getting into the whole, scenario of very, I don't know what to say, above the head kind of a methodology, seeing the ground reality and then working out and taking all the components into account, which Kerala has done. I just have 2 or 3 things to add. Maybe, well, not really random, but all related to what has been said. One, I think where India is concerned, there's been a lot of work on pandemic and what the pandemic did to the employment structure, what it did to the economy, etc., etc. But I think one area which is really left very, very understudied, and that is something which really broke whatever was left of India's economic structure. We are primarily in India an informal economy, as many of the Southeast Asian countries and many other countries, even including in Europe. And 2016 demonetization, I think, is something which decimated the informal sector, and it reflects so clearly in every data source that we see. That's why the 17-18 data, which is the result, and the 18-19, that period, that cusp, the post-demonetization cusp, is when you see major changes in labor structure, in wages, in terms of employment, etc., etc. Now, I think the other, which impacts MSMEs, which is another huge sector, is the GST implementation, which came the same year in 2016. And which really, I mean, just the fundamentals, not getting into the details or whatever it was, but just the fundamental to have one rate for one product. Of course, those insane 20 rates which came, now they have been reduced. I'm not getting into that. But the fact that the same percentage of GST, whether it's 20% or 18%, for the corporate and for the MSME, two which are not equal economic structures, to have exactly the same, which is there. So this, I think these are 2 factors which really we need to take into account when we talk about poverty levels, what has changed, etc., etc. Another impact, I think, which came of demonetization, and this is reflected very much in a lot of micro studies which we have been doing, whether it's through FGDs or any other kind of methodology, and also which reflects in the NCRB, that is the National Crime Bureau data, and that is the violence against women. And this came again. It's not as if it didn't exist earlier, but it increased very, very dramatically for several reasons. We know the political reasons, etc., what is done, but the desperation and the destitution of what 2016 did to the working force and the working people in India is something which really I think we have to go back to and reassert at every level. Because that's what reflected in Himanshu's paper of the reversal of going back into the agricultural sector. Okay, and this goes against the historical development experience of every country, that the share of agriculture in terms of employment actually increasing. Women going back, men going back, and that still reflects. Today you have what, 43% of India's working population in agriculture. It used to be 27 or 20, no, it used to be much higher, but now it has gone up in terms of the total. For women, of course, much, much more. And this increase, spectacular increase in women's employment, work participation rate in the last 4 years, and also men, is only because of one reason, and that is unpaid. You just break down the data, unpaid family worker. 60% of self-employed women, of 62%, are unpaid family workers. And for men, it is not less than at 21%. And therefore, you know, when we take these kinds of time use, time burden studies, I think we also include men into the, and particularly single male migrants, into this entire debate which is there. Self-employment, as you know, and let's not use the term entrepreneurship. It really, it just insults the concept of what is entrepreneurship and what really is employment. Entrepreneurship means capacity to take risks, vision in whatever sense you may define it, capital to invest. In 1 year after demonetization, the very small women's employment, or what we call small enterprises, actually increased, necessity driven. They became but 92% of them. Okay, so to call this self-employment and glorify it, all it means is that the state has totally absolved itself of responsibility of creating any kind of employment, and therefore we come what, you know, several people say, and which I really support, where from job loss we used to talk about, is now it is jobless, that lesser the amount of jobs. So this thing of, you know, the terms which we use, Atmanirbharta, it's like, okay, the state has no responsibility, so now here's a bit of money, you take your freebies, election comes, you have these kind of crazy things of women getting 1,000 and 1,500 rupees a month, which are given to them. But at the overall macro level, what you have is a total denial of gender justice at every single level. So in a way, the macro strategy of denying women their rights and compensating in quotes by giving 1,000 rupees a month, and that's supposed to, you know, the whole political economy of the entire thing. There are many examples which one can get into this. So the issue then really becomes is what to identify, how to identify, and what are the various methods. Of course, we can't have one method for absolutely everything. And I think that's why, Ruchira's, your contribution is really, there's so many learnings in terms of the social security which we have. But we know all the data shows is that even regular workers, I think that's the data, 60% of them are not really regular in terms of they don't have contracts. And how do we define, how are regular workers defined? They include these very absurdly names, Drone Didi, Pashu Sakhi, I mean, what Bhojan Mata, I mean, are these terms, are these acceptable terms? You know, and to count them as regular workers, they're all scheme-based workers. So then should we think of a new category of employment, you know, which is scheme-based, so don't mix them up with regular. So there are many, I think, issues which have come forward, and thank you very much for listening to me, for listening to them. And apologies again for reducing. No, I really felt, it was terrible to stop because each one of you was in the flow of talking, and it takes time to build up and get passionate. So next time, please extend the conference by 2 more days. Yeah, but one major complaint which I have officially run to her is don't give us such good food. You know, we get into this food coma where you can't think. So, really excellently organized, and I'm just so very, very happy to be here. And any support for the FAS anytime in terms of whatever has to be done, written, analyzed, examined. Thank you so much.